Which disease would you say has the highest number of deaths? Most people think cancer. The reports show that the overall burden of addiction is 1.5 times higher than all cancers and 7 times higher than all infectious diseases. Addiction is considered a physiological disease, but it meets the same requirements as other disorders and diseases, including a great deal of terminal illness. This is important to know because unabated addiction is 100% fatal. The basic requirements which clearly classify addiction as a disease include that it's chronic, that addiction symptoms are progressive, and that addiction results in extremely high claims to relapse. Drugs contain chemicals that tap into the brain's communication system and disrupt the way nerve cells normally send, receive, and process information. There are at least 2 ways that drugs cause this disruption. 1 by imitating the brain's natural chemical messenger, and 2 by overstimulating the reward circuit of the brain. Some drugs have a similar structure to chemical messengers called neurotransmitters, which are naturally produced by the brain. This similarity allows the drugs to pull the brain's receptors and activate nerve cells to send a normal message. Other drugs, such as cocaine and methamphetamine, can cause the nerve cells to release abnormally large amounts of natural neurotransmitters, normally dopamine, or to prevent the normal recycling of these brain chemicals, which is needed to shut off the signal in between neurons. The result is the brain awash in dopamine, a neurotransmitter present in brain regions that control movement, emotion, motivation, and feelings of pleasure. The overstimulation of this reward system, which normally responds to natural behaviors linked to survival, such as eating, spending time with loved ones, etc., produces the euphoric effects in response to psychoactive drugs. This reaction sets in motion a reinforcing pattern that teaches people to repeat the rewarding behavior of using drugs. As the person continues to abuse drugs, the brain adapts to the overwhelming surges of dopamine by producing less dopamine or by reducing the number of dopamine receptors in the reward circuit. The result is the lessening of dopamine's impact on the reward circuit, which reduces the user's ability to enjoy the drug, as well as the dopamine that produces the drug's pleasure. This decrease compels the addicted person to keep abusing drugs in an attempt to bring dopamine function back to normal. Except now larger amounts of the drugs are required to achieve the same dopamine high, an effect known as tolerance. Addiction is chronic and does not subside without treatment. Addiction is chronic, often relapsing brain disease that causes compulsive drug seeking and use, despite harmful consequences to the addicted individual and to those around him or her. Although the initial decision to take drugs is voluntary for most people, the brain changes that occur over time challenge a person's self-control and ability to resist intense impulses urging them to take drugs. Unfortunately, brain changes related to drug use and addiction are not a quick time to quit drugs, which is a key component. Like diabetes, asthma, and other chronic diseases, addiction is a chronic disease. Addiction symptoms are progressive, resulting in death. Centers for Disease Control and Prevention state that drug abuse and addiction results in death from several consequences. Overdose is the obvious one. These days, it isn't just addicts who injected too much heroin, even those who use prescription drugs. Just as other diseases surface repeatedly, addiction results in extremely high occurrence of relapse. Dr. Harold Orchel says that because addiction is a chronic disease, relapse is not only possible, but a majority is very likely to happen. Science has studied the effects drugs have on the brain and on people's behavior. They use this information to develop programs for preventing drug use and for helping people recover from addiction. Dr. Michael Miller, past president of ASAM, who oversaw the development of the new definition of addiction, said, at its core, addiction isn't just a social problem or a moral problem or a criminal problem. It's a brain problem whose behaviors manifest in all these other areas. Many behaviors driven by addiction are real problems and sometimes criminal acts. But the disease is about your brain, not drugs. It's about underlying neurology, not outward action. As I said before, addiction is considered a physiological disease because it meets the same with cognitive other disorders and diseases. If you don't take away anything else I said here today, at least remember this. There's 3 requirements that would clearly classify drug addiction as a disease. Number 1, that it's chronic. Number 2, that addiction symptoms are progressive. And 3, just as other diseases surface repeatedly, addiction results in extremely high occurrence of relapse. Thank you.